Hey everyone, welcome back to TSC Connect. I'm Physio Andrea and today we are having our first Q&A video. We get a lot of common questions in the comment section of the workouts that we've been posting, and a few weeks ago I also posted a poll to ask people if they had any other questions about exercising with scoliosis. So I've put the questions together in themes and we'll do our best to address them in this video. Here we go. So it seems that the most common type of question that we've been getting is, can someone with scoliosis do blank? And then you can insert a sport or an activity or a specific exercise. So for example, people have asked, can someone with scoliosis do yoga? Can someone with scoliosis do Pilates? Or bar workouts? Some people ask about doing jumping exercises with scoliosis, deadlifts, squats. Someone asked about doing free weightlifting, such as one-arm dumbbell rows or other weight lifts using one arm. And there are also questions about which machines are safe to use for people who have scoliosis. So when we work with our clients in clinic at the ScoliClinic and the Scoliosis Collective, we try not to give a blanket recommendation of what activities or exercises you can and cannot do, because it really depends on your specific scoliosis curve. It depends on the size of the curve, how many curves you have, what locations they're in, what symptoms you might be experiencing along with your scoliosis, and also how your body moves given your spinal curve. I know that we've created some videos about the general core exercises and back stretches to avoid with scoliosis. And again, because this is YouTube and we aren't able to assess every single person who accesses our channel, we are giving some general recommendations that are pretty safe to follow. But in fact, in the clinic, sometimes we do allow for some small spinal twists, really depending on, for example, how that person is moving while they're doing the spinal twist. So to answer all of those questions in one general response, usually, again, we try not to give those blanket recommendations, but rather we look to see what is your technique and how are you performing those movements and how does your body respond to doing those movements. So if we're talking about, for example, the exercise or the activities like yoga or Pilates or the sports in general, like can I play tennis or can I do swimming and those sorts of things. Each sport has so many different movements that are involved in that sport. So it's not really a responsible recommendation to just tell you not to do a full sport at all. Rather, depending again on your situation, we might want to modify some of the conditioning exercises or take a look at some of your technique or work with your coach or your community partner to look at how are you performing those movements, and are there some things that you can do in physiotherapy and you can use massage therapy to help you improve your technique while you're doing those movements so you don't, aggravate or progress your scoliosis. For example, in yoga, there are a lot of traditional yoga moves that will move the spine to the end range of rotation. But what we generally try and say is let's modify some of those movements to keep you in a more neutral spinal range, especially if you have pain or if your scoliosis is progressing. In regards to things like jumping exercises, so in general, jumping and running and walking are good exercises. The research shows that any exercise is better than no exercise. So it's better to get out there and move your body than to just sit at home really stagnant and static. But if you wanted to do jumping exercises like using a jump rope, we would want to see how are you performing that jumping movement? Where are you generating the force and where are you absorbing the force? In general, for jumping for people who have scoliosis, we're looking to see how their feet and their ankles and knees and hips are generating and absorbing the forces, rather than jumping, for example, with straight legs and then jarring the movement and absorbing that force through your back. That's when it might not feel so good for someone who has scoliosis. Similarly, for any of the exercises that people ask about, it all depends on your form. And again, even if we create videos that describe the ideal form and give you lots of tips and cues, sometimes it's really beneficial to have a scoliosis trained physio or somebody who has a really keen eye for movement and technique to watch you do this exercise and to see, are you actually able to keep your spine neutral as you do your weightlifting or as you do your squats? If we're talking specifically about heavy lifts, like deadlifts, back squats, front squats, overhead squats, things like that, I think, again, it really depends on your form, but the most important thing is, how is your body responding to that heavy load that's being placed on it? For example, with back squats, when you have the barbell and you've loaded it up with your plates, how are you in your starting stance, even before you squat? Are you able to maintain that active elongation and lengthening movement in your body rather than letting the force of the barbell compress your spine? So it again really takes someone who's familiar with movement and familiar with the technique of that activity or that exercise that you want to do. It sometimes is really helpful to work with them just so that you can get a little bit of feedback on what your technique looks like. Someone asked a really specific question here about positioning for doing exercises. So they ask, I've been curious for a long time, can people with scoliosis do prone exercises, such as the Y, W, or T arm raises, or breaststroke, for example, the movement that's commonly done in Pilates? Again, it really depends on what that actual exercise is and what your technique looks like. But I can see how if you, one of the things to watch out for when you're doing a prone exercise is, are you supporting your spine while you're face down in response to gravity? Because again, remember from some of the videos that we've posted that because in a typical scoliosis, again, this isn't for everyone, but it's common that the vertebrae will wedge so that the front of the vertebrae are a little bit bigger compared to the back. So that actually places the alignment of the spine. The people with scoliosis tend to lose that kyphosis and they become a little bit more flat through their spine. So if you're doing prone exercises, you really need to be careful not to, just allow gravity to pull your trunk into a more arched position. This is where you really need either that feedback from a mirror or from a physio or from a coach to say and to look to see if your core is able to support your spine to keep it in a more neutral position so that you don't go more into that flat back position. Someone on our Instagram poll asked, are there any exercises to avoid or exercises to always do? Again, we're trying not to make a blanket recommendation, but to be safe, usually what we say, exercises to avoid are any movements that take you to that end range of a spinal movement. So for example, if you do a side bend and you go all the way to your possible side bending range, or if you're doing a spinal twist and taking it all the way to the range, to the end of that spinal twist, because again, the end range of any trunk movement takes up the slack in your what's called your fascial system or your muscular system, and it can actually cause a little bit more compression in your spine. And again, really depends on the size of your curve and a lot of other features, because there are some movements that may actually aggravate your curve or if you have symptoms, and that's where you really need to work with a scoliosis trained physio to find out exactly which movements you should avoid for your own self and which ones might be okay, or you might need a little bit of guidance on to improve your technique. Exercises to always do. Gosh, I mean, again, it really depends on your own goals, but generally we say breathing exercises are always really helpful. Lots of thinking about that general expansion to maintain the mobility or the movement of your rib cage. Also, trying specifically to open in your concavities or your valleys, or the areas that are compressed because of your curve. Just seeing if you can spend a few moments at the beginning or end of your exercise session, even just lying on the ground or sitting upright and trying to breathe and focus your attention to expand those areas. Of course, as you've probably seen in a lot of our workouts, we really love spinal elongation exercises or stretches, so such as semi-hanging or using a pull-up bar, where you can actually like lengthen your sit bones away from your head to try and get a little bit more length and space in the spine. I think those ones are always pretty safe and they feel good for most people who have scoliosis. And also doing core exercises are always good, and I'm sure that you've heard this already, but it really depends. Like, we're not going for core exercises like the ones that are trying to work your six-pack or your beach muscles. We're really trying to focus on the exercises that activate your deeper core muscles, because those are the ones that actually try to support your spine as you move throughout your day. And so some of our workouts have a lot of exercises that help to activate that deeper core. That's more of our focus, that if you were to try and do something every day, that's what I would focus on, is activating the deep core, elongation, and lots of breathing work. There were quite a few questions asking about when people are experiencing pain or what they call popping or trembling while they're doing exercises. So for example, is it normal that I feel my lower back a lot when I do the leg extension exercises when I'm lying on my back like dead bug? Someone asked, is it normal to have back pain during this workout? Okay, so a few things. If you are experiencing pain, particularly if the pain is increasing or if it's new or if it's not going away, please, please, please see a scoliosis trained physio, a physio in general, or a doctor, because that's something that we cannot possibly give advice for over YouTube. And it's, you know, it's really healthy to have someone check your situation just to make sure that you're not making anything worse or you're not injuring yourself. So please, if you're experiencing specific symptoms, please talk to a healthcare professional to help you, okay? If you're experiencing popping or trembling when you're doing exercises, especially the ones when you're lying on your back and moving your arms or your legs, it might mean that the exercise is a little bit too hard. So, for example, when you're doing the dead bug, where you're lying on your back and extending your leg down, maybe don't extend your leg all the way down. Instead, try angling it up towards the ceiling a bit more to decrease some of that force or that leverage that's being placed, and your core can then support you in a way that doesn't compromise your technique and your form. We also got quite a few questions about spinal fusion. So can we lift weights? How much can we lift after surgery? What are some good stretches for spinal fusion? And so actually, because we had so many questions, we're going to put together a separate Q&A vid that talks specifically about pre-op and post-op spinal fusion or vertebral body tethering surgery. So there you go. We hope that some of those answers were helpful. I know that we're being vague, but that's also intentional because we can't give specific medical advice over YouTube. So please find a scoliosis trained physio in your area to help you with your specific curve. If you have other questions, keep them coming and we'll make more Q&A videos as they come up. Okay, see you next time.